Hello, everyone. I am Liz Powell. I am the founder of the Women's Health Advocates as well as G2G Consulting, and excited to share lots of updates with you today and close out with some questions. So, we're going to run through these slides so we can get to your questions. So, next slide, please. This is what we're going to cover today. We're going to talk about our awesome May 21st Capitol Hill Day, give you some updates on what's going on in DC. There is a lot. Some updates on women's health advocates, which are exciting updates there. And then we want to share a new partnership that we have with Catalytic Impact Foundation. And then we're going to close out with updates on our regional leaders and regional events that are coming up and being planned. We want you to be part of that effort. And finally, share your why. We really want to find out from you why you're engaged in women's health, why you joined Women's Health Advocates, and then post it everywhere. So Vanessa's going to talk through how we're working on that. So next slide, please. Our May 21st Women's Health Capitol Hill Day was amazing. I love this picture. To me, this summarizes all the amazing people who came out. We had over 90 folks come and participate in the briefing and then do Hill meetings and then join in our reception. We had a bunch of members of Congress. This all would not be possible without our amazing sponsors. So Catalytic Impact Foundation, Cure, Cover Us, Evie, GE Healthcare, Goodwin Health, Hologic, Sheila McHale, and Volpara. So I wanted to make sure I called all those folks out because we really appreciated them. And we really appreciated our speakers who were phenomenal. Next slide, please. And you can see in our pictures here, these are just some of the many pictures that we got, but we had a bunch of phenomenal speakers over two panels. We had Congressman Juan Ciscmani from Arizona and Congresswoman Joyce Beatty from Ohio, both come and speak at the briefing. We had great Hill meetings with several different members, offices, and then we did get to talk to some members themselves. Next slide, please. And we close it out with a great reception. That middle picture is the reception. You can see everyone all happy around Speaker Emerita, Congresswoman Nancy Pelosi. And then below that, you can see all the speakers. We had amazing speakers, real experts in all aspects of women's health. It was really phenomenal. The room was packed, standing room only, which was pretty exciting. And then, the rest of the pictures you can see, we had Dr. Sharon Malone as our main speaker at the reception, who is in the blue in the top left, along with our leaders. But we had great speakers all around, really engaged group. So I was super happy with the day, but next slide, please. I would love to pass to our wonderful colleagues, Kara Connell, who is the founder and CEO of My Perimenopause, and Nadia Monique Johnson, who is founder and CEO of Black Women's Mental Health Institute. So would love to have you two share what you thought of the day and any insights for our group. So Kara, we'll start with you.
Thanks, Liz. And hopefully you guys can hear me okay. I'm actually at an event outside Baltimore right now. The event is called It's About Time, which I think is very fitting for why we're here and what we're doing. It was an amazing day. So as somebody that's an immigrant herself, I found that there's two things that have been like super impactful in my life. One, the first time I voted, and two, showing up at this, first ever Women's Health Congressional Day. And, really the power of us coming together, meeting with staffers, advocating for why women's health, and really like getting people to understand why the importance around like the sex health versus like the conversation has really been about gender health before and what the difference is. And so I know that in these conversations, I've gained so much. Dr. Jocelyn talking about, CMS reimbursement discrimination, and, the conversations that I have around now that I can talk to around, men's reimbursement for like the same procedure could be like up to, 5 times more for the men's procedure versus a women's procedure. And, for me, that's something that like is an aha moment anytime I talk to people about the work that we're doing and why this matters. And so I just wanted to say thank you all, the 185 or so of you that are on this call, because the first step is you showing up. This is what I did. And now I've, decided to invest time and energy into this group to really spread the word around why this matters and frankly, like what needs to be changed as well too. So Liz, thank you for the platform. And I'll pass it on to Nadia.
Absolutely. Good morning. So I have to say, anytime I can get to DC is a treat, but coming for this particular event was an absolute joy. The way Liz organized, her and her entire team organized the day was phenomenal. And it was a reminder of the power that we all have when we join our voices. We do this work, and this work can be daunting. It requires a lot of energy, a lot of investment, a lot of strategy. But when you get to be in a room of women who are doing this work, who prioritize women health and actually engage our elected officials, have those meetings, are very intentional about the conversations of those meetings, and then even more intentional about following up, it's a reminder of the impact that we can make and that we are making every single. Being a part of the women's health advocates to me is a an opportunity to just take the work that we are doing individually to another level by adding our collective voices to the work. So I appreciate it. Whenever Liz calls, I'm in. When she asked me to be a part of this call, I said, well, I'm in San Francisco at the Social Innovation Summit, which is just a convening of thinkers and funders and organizers. And I'm here talking about the women's health advocates, right? I'm here talking about the work that we're doing in Alabama. I'm here talking about the work that we're doing across the country. And I value the relationships that I've already built. Even now, as I'm talking, I'm getting text messages from some of the women I met while I was there in DC, like, "Hey, sis, I see you, girl." And I just think that being a part of this, I encourage you to not let it be just a call that you tap into every once in a while. Let it be a network that you build, and let it be an opportunity for you to partner and take your work even further. And Liz, thank you to you and your entire team. And like I said before, call, text, email, whenever you reach out, I'm showing up.
Wow, you're awesome. Amazing. Both of you have just become amazing advocates for women's health. So I cannot thank you enough for rescheduling your lives just to come to DC and to be part of this, and then really making this a priority in your lives. I think that's awesome. And it's really inspiring for others to see what they can do and just how important all our voices are in this process. So thank you, thank you. And I too want to thank the amazing G2Gers that worked so hard to make it all happen, as well as Leslie Cohen and Vanessa Walker were also vital, and many, many more. All the leaders, just amazing. So lots of love. Love to see those hearts. All right, next slide, please. So we've got some updates. There's just been a few things going on in Washington. So the very next slide, please. The very week that we were there, the House was working on the tax reconciliation bill. And so that is a lot of what we talked about. And they did include significant cuts that are very concerning. So $290 billion cuts to SNAP, which is a supplemental nutrition program, and then 780 billion to Medicaid. This is all over 10 years. They now have these work requirements for able-bodied adults without dependents. And there was an interesting exchange. I'm sure you've seen it on social media during the markup where AOC clarified that if a woman has a miscarriage, she no longer meets that exemption for Medicaid coverage for insurance. So there's definitely some problems with this bill. So there's more to happen. There's also Medicare has $500 billion cuts, and then Affordable Care Act has $358 billion in cuts. And then within the tax section, they're also just many are pushing to just let the tax credits with tied to ACA just expire and not reinstate those, which would then probably result in 5 million people no longer having insurance. So there's a lot of problems with the House version. The Senate is now working on it this week, and I'm sure you heard in the media, there's pushback the ultra conservative side that it doesn't cut enough, or that it has this debt ceiling extension included in it, which, like Rand Paul upsets him. Lee is another senator, but then there's the moderates like Susan Collins, Lisa Murkowski, Shelley Mercapito, who are concerned that it goes too far with cuts to Medicaid. So we will see what happens with this. It's going to be very, very challenging for them to get this done by July. Um, but we're continuing to point out the impact on women's health throughout all of this to see how we can salvage what we can. But it is a really challenging environment right now. So, and it's also confusing. So you have tax reconciliation, then separately you have the budget proposal from President Trump, and then you have Congress working on their appropriations bill. So there's like three different things happening at once when it comes to money. The other thing that's happening is Doge. You know, obviously Musk said goodbye, he's out, but Doge folks are still there. The total number of grant terminations, well over 15,000, which totals $40 billion. 10,000, over 10,000 contract terminations, plus about 500 lease agreements were terminated. And then with NIH alone, it was 800 NIH grants that were terminated, $9.5 billion, plus the 20,000 firings. There was some effort to hire back about 20%, but it's still a mess. And one of our handouts when we were on the Hill was because I read through the entire list of all the NIH grants that were terminated to pick out ones that impact women's health. And I included ones that were touching lupus and rheumatology, which a typical staffer might not realize way disproportionately impacts women. So we try to include those as well as maternal health. Breast cancer was in there, like all kinds of grants. So we have this great handout. We then posted it on social media. So we want to distribute that far and wide so that people understand this has direct impact on women's health and the health of women. So we are continuing to educate on that, and we are working. We are seeing that if you have specifics and you go to your member of Congress, you can push back. And there's an appeal process, and there's a lot of politics happening for people to fight to keep their funding. So don't give up if this happens to you. I know I got a couple emails, people asking for advice on this. Happy to provide that. But it's just super important that we just keep up the drumbeat and explaining what these cuts are doing. Okay, so the FY26 appropriations budget proposal. The president came out with a skinny proposal. He recently came out with follow-up details on that. And lots of cuts. So, of course, non-defense cuts are at 23%, but defense gets a big increase of 13%. So that's concerning. HHS as a whole is cut down to 80 billion. There's this new administration for Healthy America, which is 500 million. That includes they're pulling over some parts of CDC, HRSA, and these other like agencies they're putting into there. So we'll see how that whole thing will function. NIH is getting a big blow as well, a 40% cut, which is huge. And then it would shift the 27 institutes down to 8. So they are keeping NCI, National Cancer Institute, NIAID, which is all infectious disease and allergies, and then NIA, which is Institute on Aging. But then it creates these 5 other areas: body systems research, neuroscience and brain research, general medical sciences, disability related research, and then behavioral health. So they haven't touched the Office of Research on Women's Health. So we are still advocating to keep that office and to keep these functions. That's what's so important, is ensuring that we have sex-based data collection across all institutes, across all studies, that we are actually using that data to inform research and better healthcare. So among many other things, greater representation within clinical trials. Like there's so many things that we still need to work on no matter how they reconfigure this thing. So that's what we're really focusing on, is the functions that have to remain as they're doing this. There's been a new vaccine policy I'm sure you all heard about, no longer recommending for children and pregnant women, and how that will have implications for insurance coverage. So there's huge problems with that. And then just globally, they're just destroying the global program for vaccine and immunizations, including polio, measles, etc. So there's work to do on that. And then the Maha report, I'm sure folks read that. There's a lot in there. It focuses on 4 main drivers behind the rise in childhood chronic illness. Women's health specifically isn't really addressed, but there are lots of things in there that we want to pull out and use to address women's health. Infertility is another big focus. The Heritage Foundation came out with their new frontier of reproductive medicine, really focused on RRM, or restorative reproductive medicine. What we want to be careful of is that we are working in an inclusive fashion. So when we address PCOS, endometriosis, fibroid tumors, it is in an and situation that can help if a couple wants to get pregnant. or just help a woman, even if she doesn't want to get pregnant, right? Like it's the health of the woman that matters. And then not exclude IVF. You know, it's all a continuum. It's all in on that journey for some people. So we want to make sure that we are inclusive of that. We'll see what the president comes out with his specific policy recommendations, but we met with several folks that are the committees of jurisdiction in Congress. They are waiting to see what the president puts out, but then they are going to obviously write the bill. So Congress will have the final say on what's in there. And so there's lots of dynamics going on there, but that is a train I think that is moving sometime this year. And then the rescission of the Biden guidance for emergency abortions for women whose health is in peril. That just happened and is really disturbing. It's not a directive to not provide abortions, but it's clearly a rescission of an important guidance. So we're concerned about that one as well. All right, next slide. Let's get on to happier women's health advocates updates. Next slide, please. So we have got some great numbers. So we just launched March was our first monthly women's health advocates call. And so since then, we've had a lot of progress. We've really built up our steering committee. We still want many more on that. We've got lots of signups. So we already have many that are in our women's health list, but they didn't specifically sign up for women's health advocates list. So if you haven't done that, please do that because that way we know exactly what you're interested in. If you're interested in menopause, if you're interested in cancer, like whatever your issue is, that's how we can make sure you're getting the right information, as well as your region, which I'm going to get to in a second. We're really starting to get organized with our regional chapters. So please do fill that out if you haven't. We have 1,300 LinkedIn followers. We only have 72 on Instagram, but we also just launched that on May 21. So come follow us on Instagram. You can see we're in all 50 states now. Thank you. I know a lot of you worked really hard to get your friends in some other states to get on board, which is wonderful. We're in 12 countries. We're going to keep growing that. And then the next slide is what I'm really, really impressed with. 923 letters sent to Congress using our advocacy online tool. That is phenomenal. In a very short amount of time. I don't even, because we didn't launch that when we launched in March. We only launched that in like a month ago. So for you all to listen and respond and get active so fast, like it's unheard of. I am just blown away by that number. And we're going to keep posting. We've got new letters we're going to put up. So thank you. Thank you. This really does have an impact. And I will tell you for sure, Leslie and I talked about this. People came to the congressional briefing because you guys sent in these letters. They literally were there because of you. So I just want to thank you all for doing that. It really does make a difference.
I wanted to just amplify what you're saying, Liz, for anyone who's on the call who is new to advocacy. I mean, 923 letters in such a short period of time. It really is exactly what you said. It's unheard of. Other coalitions that I work with, it is tooth and nail to get people to send a letter in, especially a personalized letter. So this is kudos to literally everyone on this call who shared it with their community. So your voice was heard.
And just one more note on that. The software we use gives a score on customization of that letter. And we know that customization gets us actually to people and not just into a pile. And it's the personal stories and the sentiments that you added to the letter that we had drafted that really had impact and allowed us to kind of get past the noise of what they would see in the office in any given day. And so your stories are what's resonating.
100%. Love, love, love this community. You guys are amazing. Um, the other thing I'll just quickly point out are numbers I didn't put on the slides, but we are seeing the most popular areas. Menopause is the number one issue people are saying that they are interested in. And then gynecological ovarian health, maternal and postpartum health. Those are the top three. I mean, all of these have, you know, a lot of interest. There's nothing that only has like two. Like all of these are well over 100 folks are checking it off. But I would say those three are definitely the top ones. And so our first congressional briefing of our online congressional briefing series is going to be on menopause. So know that we hear you. Our steering committee is guiding us through that. But that's awesome. Okay, so next slide, please. All right, Catalytic Impact Foundation. So I'm super excited. We have been partners, collaborating for a long time, and realized that there was this opportunity to really come together and help advance women's health stronger together than apart. So, Catalytic Impact Foundation is a nonprofit, and I'm going to let Rick and Rachel talk about their great work. But they are a nonprofit organization, whereas Women's Health Advocates is not a nonprofit. We are a lobbying organization. So there are certain donations that can come into Catalytic Impact that can support what we're trying to do to advance women's health. So that is our vision for how we're working together. And I know there's donor advised funds, for example, and other resources that are a really good fit for this partnership. So with that, would love to pass to Rick if you are on.
I am here. Thank
You
you.
are here. Take it
I am
away.
here.
Tell us about Catalytic Impact Foundation. We definitely want everyone to know about you guys.
Thank you, Liz. Yeah, so I'm Rick Lipkin. I'm the founder of the Catalytic Impact Foundation, as Liz mentioned, along with my partner, Rachel Butler, who normally is on these calls but isn't today because she's on a panel representing women's health. So I'm here alone today. We are proud to be partnering with Liz and Leslie and the Women's Health Advocate team and G2G. Catalytic Impact Foundation itself focuses on unmet healthcare needs. That's our broad mission. We're a virtual global community of industry professionals. We focus on women's health and other things as well, children's health, brain and mental health, aging, rare diseases. But absolutely, the leading area of Catalytic Impact Foundation is women's health. And it's been just wonderful to partner with Liz and Leslie. So in the event that individuals want to make tax-deductible donations to women's health, we can facilitate that for you and then direct the funds toward activities of women's health, which we do in conjunction with Liz and Leslie and the team. So the organization, again, you can find it at cifimpact.org. And we welcome you to reach out to myself, to Rachel Butler, and look forward to collaborating with the wonderful community and people on this call.
Thank you so much, Rick. Rick is amazing. Wonderful. All right, next slide, please. We are getting active and organized on the local level in these various regions across the country. And so we now have leaders that are leading, bringing folks together to organize calls so we can plan events, make sure we have real community in that local with that local feel and the connection. So Chicago, we've got Shika Jane, who's a physician, Susan LaPlay Miller, and Leslie Yerger. Susan and Leslie have been really active with our Breast Cancer Early Detection Coalition. All three are dynamos. Shika leads the Women in Medicine organization. So we are planning for Chicago. October 3rd is our event date, I believe, is what we're going with. So we are starting to plan some calls to get organized. So if you are interested in Chicago, please let us know. info@womenshealthadvocates.org. Los Angeles, we've got Nassim, Shannon, and Susan, amazing folks. They recently did a Southern California meetup that was fantastic. So they've already are starting to build this community. We just want to keep building on that. And so we'll be working to plan events in the fall there. New York, we already have Soma Patty, who's amazing with Rosie Wellness, and she helped organize the New York event we just did around the CIS conference on women's health. And we're just looking for more leaders. We know there's a ton of folks in New York. So let us know if you're interested in helping us lead New York and start to plan some calls there. Phoenix, we've got Mitzi and Azine, who are both amazing folks with background in both investing, running businesses, and Mitzi is a physician. And so they have a lot of different lens. Oh, and her amazing podcast, Beyond the Paper Gown. Hopefully everyone is following that. But anyway, they are our leaders in Arizona. And then Pittsburgh, we already have our first online event. We locked in the date, July 7th at noon. We've got Maura and Shruti leading that effort. And we've already got our speakers. We got everything coming together very nicely. So our plan is to do this online event on July 7th, talk about the value of women's health research, why we need it, and then talk about an upcoming event that's organized by Women Who Rock on September 5th that raises money for McGee Women's Health research. And so that is going to be the broader lens of why we need women's health research, why it's important, but then also specifically what's happening in Pittsburgh. So that's open to everyone. I think it'll be really interesting. We will send you more information on that. We'll have a sign up. All that's gonna, we'll send that out next week. After that July 7th event, then we're going to start organizing Pittsburgh regular calls for us to plan that September in-person event and other things that folks want to do.
And
Summer.
just to give you an idea of why we're doing these regionally is one, you've asked for it, so that's fantastic. And two, it's really an opportunity to build our communities organically with your community. So we have, over 200 people on this call. As Liz showed you the numbers, we have plenty of people writing letters, and our community is growing. But we would like it to grow beyond what we've seen today. And we think we can double those numbers on a regular basis. But it's a matter of being able to extend invitations to your communities beyond women's health, even because women's health certainly pertains to most of us, if not all of us. And we'd like to get our membership up. We'd like to have more people as part of our steering committee. And we'd also like to add to the high profile sponsors that we have that make some of this work, like our Capitol Hill days, possible. So everyone can play a role in it. You can play a role in what type of event happens locally, whether it's, an evening drinks thing or a brunch or a big activity that coincides with an event going on, a women's health event going on in your market. So please raise your hand and start making your list of people you'd like to include in our next local event.
Okay, next slide, please. Here are upcoming events. Leslie, go ahead if you want.
Right. So Liz talked about the Pittsburgh webinar that's upcoming. We're also going to be holding an How to Advocate webinar, and that's going to be available to everyone, certainly on this call, but everyone who is able to attend, because as you've heard, it's very powerful to be able to send those letters to your members of Congress. It's very impactful to be able to go to Capitol Hill and meet directly with staff and with members of Congress. And it can pertain to other areas of your life as well, though are really talking specifically about women's health here and how it impacts all of our lives and the economy and investment. It's also can be applied in other areas of your life. So we'd really love to be able to start the flywheel of having people join and realize what it is they can do and how they can accomplish it. There's also going to be another Capitol Hill Day coming up that focuses mostly on breast cancer early detection and comes out of the coalition that is part of Women's Health Advocates. And it's also going to be the same day as the Congressional Softball Game, which many of you have probably heard of. And we'll be able to interact with members of Congress, both formally and somewhat informally. There'll also be a CMS reimbursement discrimination webinar. If anyone has heard our Dr. Jocelyn Fitzgerald and some of our other members talk about it, it is egregious how this system has grown up and how stymied we are in terms of getting appropriate care, because the CMS reimbursement is just a fraction of what it is for men for comparable procedures. And then you'll see, again, listed below, our target dates and some cases confirmed dates for activities that will be running in local markets.
Great. And next slide, please. So for the 16th, we were talking about doing a congressional briefing, but we've consulted folks on the Hill and some of our leadership. And we do not think, especially given everything that's going on with budget and appropriations, that a congressional briefing will work. So instead, we're going to focus on doing Hill meetings. So we would love to have folks engage and come join us on July 16th. And on next Wednesday is our monthly call for the Breast Cancer Early Detection Coalition. So on that call, we're going to have a link for you to sign up to join us on July 16th. We'll give you many more details, but that is the plan for July 16th. Next slide, please. And I know we're over time. Let's close out with Vanessa talking about your why.
Hello, everyone. We had such a great response from everyone posting social media and their pictures of I'm attending, and write a letter, and that was so wonderful. And we want to keep that going. Here's a beautiful picture of me in Oaxaca, and we really want individuals to be able to post their own photo of why are you here, why does this matter to you. And this is the template we've come up with. We think it would be easiest if individuals would actually be able to make this themselves, and so we've made it pretty easy for you. You want to go on to the next slide? um so it's really easy. If anyone has knows how to use Canva, we have a Canva template with all of the instructions in there, where you can insert your photo, insert your why sentence, and then download and share. If for some reason you are having difficulties, we certainly don't want you to be excluded. So you can email info@womenshealthadvocates.org, and we will help you and send it to you. If you do end up sending us an email, we need a high quality photo, full name and affiliation, a sentence on why it matters to you, very important. And then when you actually post this, we want you to be tagging us on whatever platforms you are posting this on. And if you have any questions, of course, reach out to info@womenshealthadvocates.org.
Awesome. Thank you. Okay, I think we take the slides down. I posted again in the link so people can go to the public Canva link and just put in your picture. Um, we are over time, so I think we have to shift over to our steering committee call. I apologize that we don't have questions, but you can contact us at info@womenshealthadvocates.org. And I think that's a wrap. Thank you all. Really appreciate you all dialing in and all your advocacy. It means the world to us. Thank you. Thank you. We are making a difference. Keep that in mind. Okay. Bye.